Hi all, welcome back to a new session on Hematology and Immunology, facts for multiple choice questions. A gastrectomy can cause pernicious anemia due to the client's inability to absorb vitamin B12. A client who has had gastrectomy is at high risk for developing anemia. Antinuclear antibody titer is commonly used as a screening tool for rheumatoid arthritis, but it is not a diagnostic tool for rheumatoid arthritis. Complete blood count, ESR, rheumatoid factor are all used as diagnostic tools for rheumatoid arthritis. In adults, thrombocytopenia is platelet count less than 1 lakh per ml. Normal platelet count ranges from 1,40,000 to 4 lakh per ml. Thrombocytopathy is platelet dysfunction. Thrombocytosis is an excessive number of platelets. The classic symptoms for thrombocytopenia are petechiae and bruising. Pancytopenia is a reduction in all blood cells. Idiopathic thrombocytopenic purpura and disseminated intravascular coagulation or DIC cause platelet aggregation and bleeding. A xenogenic transplant is a transplant between two different species. An allogenic transplant is between two humans. A syngenic transplant is between identical twins. And an autologous transplant is a transplant from the same individual. SLE affects women 8 times more than men. SLE affects the skin and kidneys and may also affect the respiratory, cardiac, neurologic and renal systems. Kidney failure is the most common cause of death in SLE. The classical sign of SLE is the butterfly rash. What is a butterfly rash? These are superficial lesions over the cheeks and nose seen in an SLE patient. Pancytopenia and elevated ANA titer support the diagnosis of SLE. Hematologic system functions as an important part of body's defenses. Blood components play a vital role in transporting electrolytes and regulating acid-base balance. Lymph nodes are tissues that filter out bacteria and other foreign cells and are grouped by region. Lymph nodes are grouped by region as cervicofacial, supraclavicular, axillary, epitrochlear, inguinal, and femoral. The spleen destroys bacteria, filters blood, serves as a blood reservoir, and forms lymphocytes, monocytes, and traps formed particles. Bone marrow may be described as either red or yellow. Red bone marrow is a source of lymphocytes and macrophages. Hematopoiesis is carried out by red bone marrow. Yellow bone marrow is the red bone marrow that has changed into fat. Bone marrow contains stem cells which may develop into several different cell types during hematopoiesis. Some stem cells evolve into lymphocytes. Lymphocytes may become B cells or T cells. Other stem cells evolve into phagocytes. Erythrocytes or RBCs are formed in the bone marrow and contain hemoglobin. Oxygen binds with hemoglobin to form oxyhemoglobin, which is then carried by red blood cells throughout the body. Thrombocytes, also called platelets, are formed in the bone marrow and function in the coagulation of blood. Leukocytes or WBCs are formed in the bone marrow and lymphatic tissue and include granulocytes and agranulocytes. White blood cells provide immunity and protection from infection by phagocytosis. Plasma is the liquid portion of the blood. It is composed of water and protein. These are albumin and globulin and glucose and electrolytes. Multiple myeloma is more common in middle-aged and older clients. Multiple myeloma is characterized by malignant plasma cells that produce an increased amount of immunoglobulin that is functional. In cell-mediated immunity, T cells respond directly to antigens. Antigens are foreign substances such as bacteria or toxins. that induce antibody formation. Cell-mediated immunity involves destruction of target cells such as virus-infected cells and cancer cells through secretion of lymphokines or lymph proteins. Examples of cell-mediated immunity are rejection of transplanted organs and delayed immune responses that fights disease. T cells probably originate from stem cells in the bone marrow. The thymus gland controls their maturity and in the process. There are three main types of T cells: killer, helper, and suppressor T cells. Killer T cells bind to the surface of the invading cell and disrupt the membrane and destroy it by altering its internal environment. Helper T cells stimulate B cells to mature into plasma cells, which begin to synthesize and secrete immunoglobulin. Immunoglobulins are proteins with non-antibody activity. Suppressor T cells reduce humoral response. B cells are responsible for humoral or immunoglobulin-mediated immunity. B cells originate in the bone marrow and mature into plasma cells that produce antibodies. Antibodies are immunoglobulin molecules that interact with a specific antigen. Antibodies destroy bacteria and viruses, thereby preventing them from entering host cells. Five major classes of immunoglobulins are immunoglobulin G, M, A, D, and E. Immunoglobulin G makes up around 80% of plasma antibodies and appears in all body fluids and is the major antibacterial and antiviral antibody. Immunoglobulin M is the first immunoglobulin produced during an immune response, and it is too large to easily cross membranes and is usually present only in the vascular system. Immunoglobulin A is found mainly in the body secretions such as saliva, sweat, tears, mucus, bile, and colostrums, and defend against pathogens on body surfaces, especially those that enter respiratory and GI tracts. Immunoglobulin D is present in plasma, is easily broken down, is the predominant antibody on the surface of B cells, and is mainly an antigen receptor. Immunoglobulin E is the antibody involved in an immediate hypersensitivity reactions or allergic reactions that help develop within minutes of exposure to antigen. Allergies are heightened response to antigens. Autoimmune response is one in which the immune system forms an antibody against body's own tissues, resulting in a disease. Antibodies are produced by B cells. Antibodies to human immunodeficiency virus HIV may take 3 weeks to 6 months or longer to develop. In aplastic anemia, the diagnostic findings are decreased levels of all cellular elements of the blood, that is called Pancytopenia. Decreased levels of WBC, RBC, platelets are consistent with the diagnosis of a client with aplastic anemia. Reed-Sternberg cells and lymph node enlargement occur in Hodgkin's disease. Reed-Sternberg cell is a characteristic feature of Hodgkin's disease. Hemophilia A results from deficiency of factor VIII. Sickle cell disease is caused by defective hemoglobin molecule. Christmas disease is also called hemophilia B, results from a factor IX deficiency. In disseminated intravascular coagulation, platelets and clotting factors are consumed, resulting in microthrombi and excessive bleeding. The laboratory finding most consistent with disseminated intravascular coagulation or DIC is a low platelet count. People with D antigen have Rh positive blood group. People lacking D antigen have Rh negative blood group. Acute lymphocytic leukemia or ALL is most common in young children and in adults of age 65 years or older. A client with severe abdominal pain and a history of sickle cell disease may be a sickle cell crisis patient. Acute abdominal pain in sickle cell crisis is caused by sickling in the mesenteric circulation. So that's all for today. We will be up with a new video. Till then, study well, and keep watching all the videos. Thank you. If you have not subscribed this channel yet, kindly subscribe this channel by clicking the subscribe button below.